Welcome, everyone, to today's Ask the Expert. Again, we are talking about coaching versus therapy, choosing the right path to growth, healing, and success. This is a question I so often get when I talk to patients about the difference between coaching and therapy. So I was so happy when Q offered to come and talk about this with me today. So I am going to introduce Q to everybody. It's Quincy Xavier. He is the Chesapeake Center's ADHD and executive functioning coach. He has over 20 years of experience working with preteens to mature adults. He earned their Bachelor's of Science in International Business with a concentration in leadership, human resources, and finance from Johnson and Wales University. Hugh has completed research, facilitation, and training on ADHD, behavioral difficulties, learning challenges, anxiety, depression, and trauma through programs with the Washburn Center for Children, the Young Artists Program, Higher Education Consortium of Central Massachusetts, and gaining early awareness and readiness for undergraduate programs. Q enjoys public speaking, leading experiential workshops, very much a life coach, very in it with his clients that he works with. So I'm just so glad you're here to talk about this because also, everything that I mentioned in terms of training, we're going to kind of go over the difference between a coach and a therapist. So, without further ado, Q, welcome. Thank you so much. And I'll let you take it from here.
It's an absolute pleasure to be here. Thank you, Julianne. Um, it's always great. Hopefully, the noise suppression on my microphone is working, so you're not hearing the helicopters go over it in DC. It's always a fun time here. It's wonderful to also hear kind of the run through again, and I go through, and it's just like, oh my goodness, I always want to add in a little piece about like kind of working with my LGBTQIA2S plus folks, kind of centering in that space, and of course, um, being of a black body, of course, BIPOC folks as well, doing that. So always kind of looking and kind of figuring out audio good, fantastic. Thank you, Mark. Excellent. So always excellent to kind of you know make sure everybody's included. So that's always fun. Let me go ahead and share this presentation real quick, and we'll go ahead and dive right in. Sound good, Juliet?
Yep, sounds good. And we'll go through. We have, again, a little bit of a guide, but like we said, at any point, feel free to also plug your questions
Yeah,
in.
beautiful. Yeah, plug any questions in. Hopefully, let me see, make sure I have everything up. Boop, boop, boop. There we go. A little bit of background music. Cool. So there we go. So, what is therapy? So, lovely, broad, healthy question to start off with. Therapy is focused really on a healing focus. Not to say that coaching isn't a part of therapy. It is fundamentally geared towards, as a therapist, they're fundamentally geared towards evidence-based approaches, digging through and working through the processing of your past, any traumas, anything's going on, anything that is causing challenges. That is the focus of therapy. Not that it doesn't coach, not that they don't, they do. Oftentimes, the time is spent going through and processing, and so coaching takes place kind of separately often, or kind of towards a different spot. So, I also want to say, kind of one of the things that's really interesting, I think, about therapy is that when you're talking to a therapist, different than coaching, you're talking to a person that has gone through not just formalized training, but also a predominance of hours, right? So we're talking anywhere between 3,000, sometimes 5,000 hours of licensure training, not to mention continuing education. Not that coaching doesn't have similar mentoring type situations happening or circumstances, just those situations generally are voluntary, right? So the coach has to volunteer to be a part of that process. And so one of the fun parts about being here at Chesapeake Center is it's already here, right? We're already doing that work. It's every single month we're going through the process of continuing education, having conversations with providers, doing that work. So therapy puts all that together in a cohesive process. Coaching does this similar cohesive process, but we're not focused on the past. The therapeutic side of coaching, and one of the things I got from a social worker when I was speaking with them, was the therapeutic nature of coaching is that we are values and goals driven. right? Not just focused on either or, but we're very much a both and. We're very much centered around the idea of progress. So from here forward, whenever the conversation steers into conversations about the past, we are a comfortable, we are a cozy, we are a safe space for that conversation to hold it. But to carry that conversation to processing, we offer questions, things of that nature that you can ask your therapist. One of the things that's really great about coaching as well is that we're constantly buoyed against quantitative and qualitative measurements. One of the first exercises I give anybody when coming into coaching is an activity that really digs into kind of what's happening in your day. And this is an activity that will follow you throughout your coaching process. So again, we're really kind of partners in this. We're working together, right? You're not in, there's different styles of therapy, there's different styles of coaching, and there's different styles of coaches. So there'll be coaches that are very much on it. They're showing up with templates, they're doing these things. There's other coaches that will go out for a walk with you, that will sit down in a cafe, right? That'll meet you at a library. It just depends on what type of work you're trying to achieve and which, from an executive function standpoint, which skills we're working on. Okay. We talked about some of the key differences, but we'll dig in a little bit deeper here. Again, the focus of therapy really digging into that healing aspect, really digging into kind of the overall mental health of the client, of the patient, of the person. Coaching really has that goals driven, and I almost the goals driven part is always a challenge because like the goals kind of have the anxiety of getting to the goal and kind of that like loss of once you achieved it. So we've started centering heavily on values. So that way we have goals that align along the way, similar to the way in which we talked about objectives and goals in the late 1900s. Let me not date myself. All right. Timeline. Therapy is really taking us all the way from when we have first memories all the way up till now. And that's really dependent upon you. Coaching is really from now into the future. And as much as dependent upon you, I'm also asking you a ton of questions and I'm offering tons of things that you either agree with or more importantly, you disagree with so we can figure out what works. Both are evidence-based approach. The difference is on this side of the house, the research is right, it's happening in the moment. Whereas on therapy, we have peer review, we have clinical studies, right? There's research psychologists, there's people literally doing the theory of figuring out the practices that we're kind of figuring out now, but refining them there. I want to draw a distinction also as well, not to get too much into the weeds, but there's clinical psychologists and there's research psychologists. And our research psychologists are doing the work of kind of refining all the stuff that we do and the things and the ideas that we have in the field into things that fundamentally work across the board and what the challenges are there. Oftentimes, what works for one person doesn't work across the board, right? So, me getting an alarm in the morning three times will wake me right up. You getting an alarm three times in the morning is just a nice sound that happens, right? If at any time in any way, if there is a one of the questions that we ask when we start coaching is, do you have a therapeutic relationship? And I ask that question in a broader sense. Rather than just centering on coaching and therapy itself, I kind of look to see if there's a community around the person. Oftentimes, with affinity groups, religious groups, other types of associations, there might be this group around. So I'm often looking kind of for that. If there is a therapist there, great. If there isn't, then we can work with you to help you kind of figure out. I can work with you, the coach can work with you to figure out what will work, what will be most effective with you. Of course, clinical fit is most appropriate or most incredibly important. You gotta vibe. The vibes have to be there. Um, Past trauma, emotional processing, life instability. We've talked a little bit about those, but my sense is those are somewhat self-explanatory. If you're sitting in your life and the floor is lava, that's an unstable life. Right? If you're constantly thinking about things that happen that are troubling, these are traumas, no matter how insignificant. I want to that significance piece really gets a lot of folks because they're like, it's not a big deal. You're still thinking about it. It's still troubling you. Whatever it is, it's not small. It's what's happened. Emotional processing, understanding those distinctions, really dealing with grief, loss, dealing with relationship challenges, dealing with you, the relationship between you and yourself. Oh my goodness. And of course, mental health concerns like acute or non-acute anxiety, depression. When you're trying to get into coaching, or when you're looking at coaching, you're deciding between coaching. Again, you're now present, you're now looking forward. You may even come out of therapy, or you may still be in therapy. One of the I wanted to start the whole conversation with this, and this is how you know I'm just having a conversation with y'all. Um, mhm. we titled this Coaching versus Therapy, and we did that as kind of like a tongue in cheek misnomer, but also as a chance to say, hey, it's therapy, it's coaching, it's therapy and coaching. The question becomes which, when, and then from there, when you are ready, when to work on building a network, and so that way you have more of a community to rely upon. Oftentimes in coaching, when we're looking at a definitive thing that we're trying to achieve, most folks come to coaching. I want to do this. I need to talk to a coach. This is really bothering me. I need to talk to a coach. Every single time, I need to talk to a coach. Whenever those phrases show up, are generally times where I'm like, boop, we should probably talk.
Do you feel, just to jump in my own question here, and then we
Please.
also have a really good question that someone already brought up. Um,
Ooh.
do you feel like coaching is something where um, you can kind of jump in at any point, whereas like therapy is something that you really do have to go through? You know, if I'm engaging
Mm,
in therapy, I really do want to cover to get the most out of it, to really do all of it. I'm covering, like you said, past to present and seeing how that
mhm.
influences everything.
Yeah. So when jumping into, so a great time to jump into coaching really is if you're currently going through a tumultuous time, right? And you don't have a therapeutic or therapist, talk to a therapist. Let's get you in therapy ASAP. Period. Right? Because we gotta figure out if what's happening, what's going on with you is just like, oh my goodness, you know, paper cut, snag nail, really trying to like overwhelm, or if it's something where it's causing full stop. We have to change things. Therapy. Coaching, right? The oftentimes people will come into coaching. There's only probably about 5 or 10% of people that come into coaching, and we're just like, time out for a second. We need to talk to a therapist. We need to do this. One of the first things we do as coaches is figure out whether or not coaching is right for you. Right. So you can to answer your question specifically, you can come in and out of coaching kind of at any time. I say kind of. When you start coaching, it's a good idea to not to say that you're going to know what the 3 months are looking like or the next year is going to look like, but that you're committed to be in the process of coaching. Coaching, much like therapy, is a process. And if we come in thinking that in 1 month I'm going to make this tremendous amount of change, that's not what coaching or therapeutic coaching or coaching is. It is a engaged process that involves your participation and it requires you. It's not a demand, it is a requirement. We do need you there, and we do need you there so that way you can go through the ups, I got it, and then the downs when you don't got it. And so we can talk about how you get it. So you got it and you're good.
That's so interesting about 5 to 10%. So I was wondering that because, you know, when we talk to people about therapy and coaching and this whole conversation, um,
Yeah.
we, you know, that's one of the things like, is this right for me? And so 5 to 10%, you know, you do talk through like, and kind of figure out that therapy is a better place to start. Um,
Yeah. Yeah. And so for some coaches that might be larger, right? For reasons of just luck of the draw, people generally come to me when they're ready to work on thing. Some people come to me when it's not a big thing, they're just working on skills. They're like, oh my goodness, I know this is the problem and this is a good time for me to work on it. And then of course something happens because life happens, and so we're really in the coaching.
one of the questions we had, and I know, you may be touching on this, but the solution focused brief therapy. So that's a therapy that really focuses on identifying and achieving specific measurable goals. So how would that be different than coaching? Or are there a lot of similarities between the two?
So I'm not the expert. I'm not an expert on solution focused brief therapy. Um, anything, however, when I'm my background and I work with a lot of cognitive behavioral therapists, uh, folks that are running individual and group DBT, and things of that nature. So I'm often interested in, and I believe internal to the agency, we are making a switch and doing work inside. So I'm becoming hip to what's going on with that. So I don't want to speak overly about something that I'm not the most the formidable expert on. It might just be a language thing, but anything that involves measurement and goals, I love it. I want to know more about it. Please send me information. Look, lo and behold, probably somewhere in a catalog somewhere, it's based off of somebody's old work and it's called something else. Remember, I always like to remind people about this thing, and this has nothing to do with psychology. It's everything to do with like the cosmos. Dark matter was talked about for 40 years before the nomenclature caught up with what it was. So like it was called that, and then it takes like 40 years before it's like fully adopted as like what we're doing as what it is. So that's all. Anyway,
Yeah. And like, like you said, with all of that, there are so many different types of therapy and everything. So, um,
I
so
love the
the
name though.
overlaps.
The
Yeah,
solutions is
exactly.
the solutions part is troubling because it makes it seem like it's going to solve, and that's the part where I'm just like, ooh. But I do like the brief part, and I do like the idea of like milestones, and I do like the idea of goals and all those things. They sound great.
So the
Oh, how did this
overlaps.
succeed? Yeah, yeah, yeah. I would ACT. Oh, I love these
Oh, true.
questions. Am I supposed to
Yeah,
be just reading these questions, or are
sure.
we
Yeah.
supposed to just
I mean,
have this work?
so
Okay,
one of the questions is what
because I'm
about
like,
ACT and habit change?
I love that we're mid-presentation and we're getting these questions. This is the most neurodivergent, neurodiverse conversation ever. It's trying to do the
I
thing, and I'm
love
just
it.
like, no, we want to have a conversation. Let's do it.
Yeah.
All right, so ACT and habit change. Oh my goodness. Okay, so that's like the the ACT matrix, right? So one of the things I'll draw on the board is this lovely line that goes across, and we'll talk about what it takes to what it means to run away from something, right? If you're a bunny, right? And we see a bunny running in a meadow, right? We see the bunny running in the meadow, and they're like, oh my goodness, look at how the bunny runs. I want to run like that bunny. Look how they run. They're so agile, they're so that. But what we don't know, right? It just doesn't occur. Are they running towards a carrot? Are they running away from a wolf? We have to have a broader view. And so when we're talking about habit change, first things first in ACT, which is acceptance and commitment therapy, a part of the third wave of cognitive behavioral therapy, right? This is pioneered in one of my favorite books to talk about is Dr. Stephen Hayes's work, A Liberated Mind. It's a very interesting primer. Not that I'm bigging up anything, but it's just a really interesting and very clear way to talk about ACT and change. ACT is centered around mostly around anxiety. And so the things that inhibit you taking that action. So ACT shows up a lot in our task initiation work, right? How do I overcome my internal objections? How do I move away from literal coherence into like psychological flexibility? And so with the feelings and behaviors matrix, we can talk about how we end up in a negative feedback loop that keeps us in place and how we can work on a positive feedback loop that potentiates our movement forward. That's habit change. What generally would determine CBT or DBT? Your therapist.
Yes.
um, yeah, your therapist. Quite honestly, like, are we looking for a guided, focused, central? Like, are we looking for a structured approach? DBT is a fundamentally structured approach. Right, it has tons of tools, it has tons of like takeaways. It literally has workbooks and apps and things of that nature. Not that CBT doesn't, right? I just mentioned a book. Okay, they're just two different ways. Generally, and I want to put a big capital G in front of generally. DBT is focused on trauma. DBT is focused on childhood trauma and how it shows up later on. DBT was developed for borderline, developed for bipolar, developed for these particular type of diagnoses. It is used across the board, right? Much like because we once we see merit in one place, people start practicing like, oh my goodness. Again, coaching, therapy, research. These things work together, right? So all of a sudden, and you'll find if you go globally, right, you'll find DBC, dialectic behavioral coaching. You'll find CBC, cognitive behavioral coaching. You'll see these kind of designations start to pop up as people start expanding and start practicing and start seeing results in ways that are supported by practice. Um, ACT, acceptance and commitment therapy. Oh, beautiful. They already got to. Can someone
Yes.
please write the title of the book, which was just mentioned? My hands are full with water, so I'm going to leave it to y'all, beautiful people. I'm going to say it clearly now. A liberated mind
A
by
liberating
Stephen,
mind.
that's Stephen with a V, Hayes, Hayes. Please type
Okay,
it. I love
perfect. Can you talk a little bit about CBT and DBT? Because so CBT, cognitive behavioral therapy, that's kind of the gold standard, would you say? Like that is that's what most people utilize, and then you get more specialized, like DBT. And can you just explain a little bit about the differences between those two?
First things first, I have to big up one of my favorite, not one of my favorite folks to work with, folks on Brianna, therapist here, social worker, CBT, Dynamo. When it comes to folks that are having trouble with seeing the silver lining, moving in a particular pattern, getting these things in alignment, this is the kind of person that you would talk to. These are the kind of specialists where it's like, oh my goodness, I have this coach that's talking about CBT. Do I need a therapist? CBT would be great when it comes to literally making the similar to your brief, right? Similar to those measurable goals, similar to the ways in which we're working on, right? The ways in which you're processing what's happening, right? Really getting you into the action. DBT, and again, I'm not a therapist in these disciplines, so this is from a coach, right? The first person I talk about as soon as we start talking about any of these things. I had a wonderful conversation with a DBT facilitator out of Bethesda DBT. Right, they're no longer there, so I'll let their practice be their own. But ultimately, at the end of the day, DBT is a chance for us to really get into emotional alignment, so that way we can regulate, right? Not control, but regulate, right? Find a sense of a way of moving forward without all of the obstructions. And if you understand when I say obstructions, then that makes total sense. And DBT might be something that you want to look into. And this is a boilerplate. I'm doing a lot of couching on purpose. And I want to be clear about that. Because at the end of the day, when you're asking these questions, I might be the 10th person you talk to, right? That gets you to talk with a DBT or CBT specialist so you can have a conversation with them about their approach with this modality and discipline. And so that way, as you start gaining understanding in what this does and how it might be helpful, you can also see if you want to work with this person, if the vibe's right? Because you're gonna be digging all the way in your past, and you want to make sure that you feel comfortable with the person holding it together while you're in that space.
I think that's such an important component too, is obviously we know it's about the fit with therapy or coaching. And so even knowing like just what questions to ask or what things to kind of prepare you for both. But I also like how you distinguish the different, credentials, like especially for a therapist,
Mhm.
how there are the research based, like, PhDs who may do
Right.
therapy and they have more of a very conventional approach, a lot of
Yes.
research driven. And then there are social workers who have very different training, and just
Yes.
so I think it's also figuring out the style that works best for you. If you want someone who is very, focused on like again, conventional, or like you said, even if it's a coach or a therapist who, goes for a walk with you, like finding what works best for you, and knowing those questions.
One of my
Um,
favorite things in that
sorry.
line is, oh no, you're doing great. I saw the question. I just want to kind of like piggyback on that real quick and say, your social workers are incredibly resource driven. They have so many great resources. Oh my goodness. People are like asking these questions about where to go. Talk to your social workers. Oh my goodness, they're just like brimming with all of that information. Also, occupational therapists, don't sleep. Oh my goodness, they're like the unsung heroes of this game, right? They're literally helping you with your day to day literal movements. How do I move myself around? Your research, your clinical psychologist, there's so many modalities, psychodynamic, relational, right? Deep, we just talked about DBT, we talked about behavioral therapies, right? And then we get into Jungian stuff, right? Art therapy, music, right? All these different ways of showing up in a clinical way and how those get used, right? And then research, developmental, cognitive, developmental, neuro, all the rest. It just goes, there's so much work going on and there's so much necessary refinement happening because the research set now includes everybody. And so we have a lot of work to do. For those of us who do not have access to face coaching, can you recommend any self guided activity or program found on the internet? Ooh, I would recommend that that's why we were, okay. So, ooh, the book I just recommended is fantastic. Go through it, read it. Any book that you can get your hands on, right? ADHD Works, all the rest of those things, these are fantastic. One of the things that I want to be considered around with that particular question is intelligence will only take you so far, right? I have a lot of texts. My house is a library. I love it. But I'm not fooled by knowing. One of the things we talk about in coaching is when we talk about acceptance, right? Not acceptance in commitment therapy, but there is a capital A acceptance, kind of ourselves, our life, our environment, capital A acceptance, even our relationships, the way in which we understand things. There's knowledge, there's understanding, there's experience, there's agreement, and then there's acceptance. And this is what we use in here to talk about that. And I don't want you to be fooled by knowledge. I want you to be encouraged by understanding, and I want you to be validated by experience, right? So if you're not able to get a face to face, that's why we do remote. I'm almost 100% remote. We also, number of folks do remote groups as well because peer support is so important, right? We talk about community. A lot of people know community as people that I fundamentally agree with, and community means we're willing to work together. The agreement is the work, right? You get new perspectives because of people that I'm a waffles person, right? I love waffles, which means I love maple syrup, which means I'm a big fan of butter and ghee, right? And if for people who understand those distinctions, they're applauding. For those people who don't worry about it. I'm gonna get to the point in a second, right? What works for me when I meet somebody who loves French toast or pancakes, and by the way, French toast is delicious. I learned something new about nutmeg and cinnamon and spices that don't go into my waffle. I learned something different about the composition, the ways in which I can understand this work and practice it, experience, right? So I don't want you to be fooled by knowledge. And we talk a lot about building up your knowledge. Conversation builds that understanding, and then experience. You actually doing it brings us back to what we don't know. Um,
I think, and also, like you said, like knowledge is not enough to change behavior. Like we know there's certain things that we need to do. So I think that's why we're here talking about like what it looks like to work with a coach or a therapist. And so a few of these questions, and I mean, we're just going to get into it and hopefully, you can wrap up with your slides. I love your beautiful slides, but I think these are the important questions of like, what does coaching look like for ADHD on a day-to-day basis? Like, how do you prep the clients that you work with? Is it completely different per client? Is it a weekly thing? What does ADHD
so
coaching look like?
I used to have a therapist. Coaches have therapists, coaches have coaches, therapists have therapists, therapists have coaches. It's a fun little game, right? Because if you're going to do this work, you have to have a place to go and like get your needs met. On a day-to-day basis, ADHD coaching looks like you practicing what it is that we talk about in session once a week. Most folks, about 80% of folks that meet me, that work with me, right, meet me about 1 day a week for 1 hour. Not the therapeutic hour, I know, but the actual 1 hour. Caveat, the first about 8 to 15 minutes of that time is literally you and I getting settled. Water, coffee, right? A notebook. Oh my goodness, I forgot my pen. No, oh my goodness, go get your pen. I gotta go to the bathroom. No, go to the bathroom. That's what this time is for. At 15 after, I'm calling to check if everything's all right. Texting, calling, seeing what's up. The day to day is really handled by you. That session is where we get to talk about what happens in that day to day, what you're checking in on yourself on, what you're using your glassboard or your whiteboard for, right? The point of your time in coaching is for you to be in conversation about what's happening, what you've done, what we've missed, right? So we can get into the practice of not making ourselves detrimentally wrong about what we miss and realize that's what it means to be human. And so that way we can get to the work of making change in spaces, right? Re changing our understanding because most times we're using the mechanisms, we're using the machine that we need to use to actually do the thing, but we're using it in reverse, right? I'm negotiating, I'm using my incredible debate, my lovely left brain, like the way in which I can logically process things in order to bait myself out of waking up, getting out of bed. I'm talking myself out of taking that first keystroke, right? And so we work with somatic practices, we work with kind of what's showing up, somatic practices, even exercises, right? To work on what works around that thing or what can work directly with it.
What are
From
some
there,
of, oh, I'm sorry. I was just going to say,
no, you
before
can
you
go
even
ahead.
jump in from there, what are the main things that people come to you for coaching? Like, I feel like for ADHD in particular, the number one thing we hear is I'm overwhelmed. Like, how do I get a handle of my day to day? So, what are just the whys of walking into even, what do you get into in that first?
Yeah, so most folks show up these days, overwhelmed burnout. In DC in particular, I love to call that we have the ADHDs, right? And instead of having like a type A ADHD person where they're just like the overcompensation is like, boom, I'm here, I'm doing the things, da, 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 right? So the person that you would quote never know they have ADHD. I get a lot of that. A lot of folks that are dealing with that particular kind of pressure. I'm dealing with identity a lot now, right? Not because I have ADHD, who am I, right? But now that I understand ADHD and I'm moving through this world, what am I doing? Why am I doing it this way? Why am I trying to meet this particular social norm or tradition? Or why am I doing this thing? And oftentimes that's where, to your point, the life coaching comes in. We're just like, hold on for a second. Why did we sign up to do it this way? And what does transition look like as far as career, right? What does that change look like as far as relationship? What does that look for as far as geography if that needs to change? Mm, a lot of folks are coming in these days. Of course, probably like a subset are people. There's probably about a good chunk of folks that are just coming in. Q, I've been hanging out for 10 years in therapy and doing all the things, and my relation has gotten to a place where we're about to have kids, make transition into a new city, go to a new thing. And now I have the time, the access to capital, and the resources around me to actually focus on the skills that I've been using neurostimulants and maladaptive behaviors in order to overcome. And the only reason why they're maladaptive is because every single time I get something done, I'm not only exhausted, I feel terrible about myself and what I just did, even though it was amazing work, even though it was award winning work, right? Um, one of my favorite, and I'll leave you with this before we move back to the what happens or further, is that FX show Bear
Mhm.
about cooking. This show's great. He has this one moment where he talks about the whole show. He's talking about uh, he never won the James Beard Award. He only maintained it. And if you know anything about the James Beard Award, one of the hardest things you can do is maintain the James Beard Award. So we have immediate not recognition of our own success. We don't know what success looks like, even when it shows up and it's literally giving us cash money and support. He talks about the 10 minutes where he had a literal disassociative moment, shaking, trembling, and he just gets back to work. Package all of that emotion up, shove it to the side, and just get back to work. And so there's a lot of folks that come in with this, where they've taken and packaged away all this emotion and all these feelings and all this everything just to be good at their craft. And now there's anxiety with the craft. Now the craft doesn't even bring joy. And now they're trying to figure out, hold on for a second. I have a therapist, or I'm thinking about getting a therapist to deal with this, but how do I even orient my life so everything I touch doesn't make me ah, so how do we set up somatic practices in advance? How do we set up a world around so that way each thing is something they can start to notice, they can start to recognize as success and placing those around them. Of course, in that moment, that's a good moment of therapy and coaching. And that's where I talk to therapists, psychiatrists, and those things and those folks because we work together. love a good release of information. Let me know what I can't say to somebody. Fantastic. I love it. I love
Mhm.
telling people that we can't talk about things. That's one of my favorite. That's one of my favorite things. I have my patient that told me I can't talk about this.
Mhm.
Uh, just to circle back for a hot second, coaching, at least with me, kind of goes through four modules around task initiation, planning, time management, task management in particular, right? And then resourcing. How do I pull people in? Who are my resources? What's my network even look like, right? I like to call this, I affectionately call it our soil, because anything to grow in a garden, it needs good soil. So what's your soil look like? For some people, they're like you, it's been turned over. For some people, they're like, I don't know how to ask people. I don't know how to structure the question. So that I hope that takes us to a place. Yeah.
I think that took us to a place. Yeah. And I think that also, I mean, so again, it's what to expect going into coaching. And it's really
Mhm.
meeting you where you are, what is getting in
Mhm.
the way, and then
Yep.
challenging like the negative thoughts. But like you said, there's a lot of just also unpacking what has got you here. And again, in this area with the stress and the burnout. And I think that's also so common with ADHD is, you know, like you said, kind of like self-defeating. We're constantly run by a motor and continuing and continuing. And so when you are in therapy, because this is the other way that we talk about coaching, is that we focus on the executive functioning piece. And I
Mhm.
feel like this is more in coaching than therapy. Like there should be a component in therapy, but what kind of like psychoeducation do you do about executive functioning? Because we hear that term and then it's like,
Yeah.
what is executive functioning? And yeah, like what is that? What does that look like in coaching?
Yeah, so in coaching, it's really interesting because a lot of times when we talk about executive function, we talk about it outside of traditional mental health. It actually shows up in neurology fundamentally, right? Traumatic brain injury. Somebody sustains an issue and they have an impact in their executive functioning skills. And so like the question becomes between neuroplasticity, the way in which your brain like kind of handles and restructures and configures itself, as well as practice, how do we encourage, right? Encourage positive executive function. The education around that is similar to what happens with our therapists. We take continuing education courses, go to workshops, we talk to each other. I know it's crazy. We have communication. We talk to each other. We see what works. We ask questions of each other. Right? At a base level, we are a community of people willing to work together towards your mental and total health. So, from that standpoint, we're using each other as resources. After that, we have continuing education that builds on top of that. So once a month, sometimes for some people, twice, three times a month, because you just like to be involved in the world, in this world, yay. You go and you learn more, right? You learn other approaches, right? You talk to other clinicians, you talk to other folks that are doing research. Right now, there's huge work going on, right? If you go ahead and look at trauma, there's a huge jump going on in trauma right now relative to its treatment, therapy, and its management. It's wild. They're talking about session count therapy right now, where we can actually count the sessions towards like actual measurable success. And interesting is happening that's happening in the and I want to say this as well because there's looks like practice especially one thing that's really curious that's happening is the audience, right? Is the community of people that have diagnoses and the ways in which they're looking at autism and ADHD critically. They're applying even a particular critical, if not academic lens to the work and asking questions like, hold on for a second, when we say executive functioning, what do we mean and who is this for? Who created this idea? And not in the sense of like, why that, but in the sense of trying to be more well-rounded as a person, right? Not do a singular thing, do many things. Well, um, so when it comes to psychoeducation, ongoing continuing education courses, workshops, certificates, right? Some of them they're just stacked up, right? Because at the end of the day, they're great, but what's really important is the practice of these things, the community that we're attached to, so that way we can rub shoulders and kind of be like, I tried that thing and it doesn't really. I'm getting really strong pushback. What's going on? And all of a sudden, you're having a conversation about that intervention meeting demand avoidance and how we overcome that.
And do and Lisa brought this up, which I think is so important. So in your work with like again, the understanding of ADHD I think is so important because the executive functioning piece can cause so many of the other symptoms. Like I've heard the term like ADHD induced anxiety of, just like the not being able to organize and plan. And so do you feel like that like the executive functioning piece and providing psychoeducation with your clients and working with executive functioning, do you think that's something that is more so coaching than therapy,
So you're saying that the education piece is more, the psychoeducation when it comes to executive functioning is more in coaching than it is in therapy?
or just even bringing it up? Yeah, like in terms of helping your client understand the impact of executive functioning and working on those skills.
My body language is going affirmative, and my internal brain is going, hold on for a second. And that's to say this: coaching, we definitely do a ton of psychoeducation because we not only want you to know, we want you to understand, right? I talk about this, right? I want you to know and understand. The difference being is that your understanding is not processing. And one of the folks in the chat there wrote, sounds like therapy. And I want to be clear about this. Your understanding of what's going on is not your processing of what's going on. It is not in totality. You may understand it, but the processing loop continues. We still have more things to do on the therapy side. So therapy is not coaching. And even though there are therapists who coach and there are coaches who have therapeutic designations, right? They might be licensed therapists. The coaching is where we get way more involved. We're actually saying, this is what's going on, this is what we're doing. And you're saying, yes, no, maybe so, let's work around this, let's figure this out. And we start shaping what we know works to what works for you. That's the difference. Your therapist may shape and they may coach, right? But that's a lot to fit in 45 to 50 minutes. Also, the United States, unlike a couple of other countries, I think it's the UK and Australia, I always talk about this, they have designations in coaching psychology, period. And they still have coaching as an unlicensed designation, right? They're still like, hey, there's something unique about what happens in coaching that needs to have a certain kind of freedom to have to be in this space and have access and work with folks. So I mentioned
I think
working with executive. Okay.
practically, yeah, this is a great question. So if someone does have trouble with executive functioning and life organizing, what does it look like when you work with clients on that? Like money struggles, paying bills, paperwork. What does coaching look like in terms of those things?
Let me see. Is that the last question?
Yes.
Yeah, yeah. Yeah. Hmm. It depends on where we're approaching those particular challenges. If it's the paying of the bills in the sense of like I have the money, I have everything organized, and I can't hit the pay bill button because of anxiety, right? Then we have a coaching practice around like what tools we're going to use around that, what tools we're going to practice consistently, so that way we have a system, so that way we're not just band-aiding a problem. If it's a function of I don't have the resources to pay the bills, then we get into the actual organization of our finances. The money coming in, looking at service, looking at different tools that we might use, analog tools, and then we move into digital tools, and then we get into digital hybrid like AI tools. I often like to say that we practice the skill, we work on the skill without the tool. So we have the fundamental skill. Then we work on it with the tool, right? It's kind of like you see CrossFitters jumping up on a box, right? They keep jumping up on the box, right? And you're like, oh my goodness, I want to do that. And then you look at the box, and you're like, that's way too high. I'm not jumping on that. Right. And that's most tasks that we take on, whatever it is, that paying of the bill, right? The organizing, whatever it is, it's that box that you see everybody else jumping on. You're like, absolutely not. I'm not skinning my knee, right? And so you go, and so the place where we can make that kind of change, right, is in places that will be laughable and dismissible. Dr. Hayes talks about the napkin. I talk about this as well, the napkin. I can have you do the box jump onto a napkin. And when I stand on the napkin, I'm a napkin height tall. I'm taller. Look at me. I'm standing on a napkin, but it's only a napkin. If I had it, yeah, it's only a napkin. And so it's easily dismissible because it's laughable. And I can increase its size to a book. And the difference between me jumping off the napkin and me jumping off the book to my muscles, it's the same muscles, right? It's the same muscles. It's the same muscles. So if I'm afraid to jump on the box and I want to build what it takes in order to do that thing, I got to go where it's laughable and it's easily dismissible to build the skills in order to get up to that, get up to what that is. Now, I said something about tools, right? When I jump onto higher and higher things, I might even climb up something because it's so high. And that's parkour. I love parkour. I love watching those crazy cats, right? They're jumping off of stuff, they jump between, they're shimmying down, right? And when they jump across, they grab onto a flagpole and they shimmy down. They go between two buildings and they shimmy down. They come over top of fire escapes. Now, I'm not telling anybody to parkour. You do what you need to do. There's lovely gyms that'll teach you how to do it safely. What I'm telling you about is the way to learn these things safely. What I'm telling you is that the tools that we jump in early might be a little bit soon relative to the skill that we developed or the skill where we're at. And so we miss the opportunity to develop the skill that supports the tool. And so the tool just stays there.
Very true.
We want those skills. We want those skills. Yeah.
How do you help clients get out of ruts related to these processes?
Depends on what kind of rut it is. Always. Um, if it's a, we, no, I want to be like I just got done doing it, but literally we just got done working through a 3 week rut. Right. I'm doing that thing I do. Q. What's that thing you do? Story. Right. We're already in story. We're in storyland. Right. Always doing this thing. We're already in storyland. We haven't gotten to what's actually happened yet, but I'm doing that thing we do. Right. And that thing I do is I'm pushing on my work off and trying to do it all at once, and I'm holding back on assignments and things of that nature. And so most times we're doing that because the way that we've done things is this way, and we think this is the only way to do things. We have a perspective challenge. And so when somebody's in a rut, often I can talk about a perspective, but I need them to physically feel the change in perspective. So we talk about somatic practices, breathing exercises, outside, sunlight. We might even take the session outside. Last session, they were outside. I talked about being outside. They chose to be outside. Right. Now, when they chose to be outside, we can have a conversation about decisions and choices, but they just made one. So I congratulate that decision. I congratulate that choice that supported that decision. Most of what happens when it comes out of us is we have a failure of perspective to see our own successes as they're occurring and accruing. We have a tendency to look down on everything. Talking about the bear example, if you've seen that show or you think about your own life, when somebody has said, "Hey, you look really good," and you're like, oh, right? You're immediately deflated as soon as somebody tells you a compliment. What? You put on a whole outfit to look the way as good as you look, and now somebody's noticing it, and you're like, oh, that's where it starts. If we're trying to get out of a rut, I have to be in a position, and I'm working on it in coaching. We work on a position whereby which you can begin the process of recognizing your own successes as they occur. Not waiting for the external validation, because again, external validation ain't the ticket right now. Right? You're already doing the thing. They're just the love is disintegrating before it can impact us. So we do exercises, writing exercises, we talk through, we literally physically get them into the work and create clearings with somatic exercises so they're not overly bombarded with what's happening in their mind at the time.
I also, the example that Lane gave is spot on of like a good, getting in a rut of like a big mess. And like once you have a big rut or a big mess, like the avoidance of it, and then it just continues. And so I really like the napkin analogy of like make something so laughably the next step so laughably like easy and then celebrate those small wins because it
Yeah.
can't just be conquering all of it. Like it is about getting out of it step by step and then working with the coach to maintain it. I think there's so much accountability too. Like do you have clients that you work with now that are just meeting with you on shorter increments because it's now just like, okay, these things are working and
Yeah.
which is great. That's the point, right? Yeah.
The point of the entire practice, at least as I see it, right, is to allow the person the opportunity to become an expert at coaching themselves, so they can advocate, self advocate for people coaching them. So effectively, right, after a period of time, you are literally coaching people on how to be a support to you, and you're being a support to them by doing it. It's a reciprocal relationship. The breaking things down, I love, right? Um, it's one of my favorite things. We always love breaking things down. I call them breadcrumbs make weird, do not compose bread. So I call them cake crumbs. So they're like delicious because, cake pops and then crumb cake. Sweets, delicious. When making them small and celebrating them, oftentimes people say, I don't think like this isn't what I don't think this so far. I'm like, well, right now you still think that what's happening in your head is thinking versus just something that's swirling around up there. So like, why don't we put something else to swirl around up there and see what happens after a couple of weeks? It generally works. It generally works. Not it's not, and I want to be careful with the it generally works part. There is no just. There is no one thing, right? This is a part of the executive dysfunction. The black and white thinking, the magic pill thinking, the if it's not good, it's all bad, and if it's not bad, it's all good. There's not just tons of gray, there's our life occurring in this space of gray. And part of the work of ADHD, specifically executive function coaching, specifically around emotional regulation, is getting you to identify, to notice and acknowledge, notice and acknowledge, notice and acknowledge your successes, and notice and acknowledge mess ups as not you, as merely a thing that got done. And that takes practice. That takes time because we have a lot of time telling ourselves the other part. Um, not
We have
cutting.
some great
Yeah.
resources just shared. And then also
Yeah.
just what made me think of that is another one of our coaches I was talking to was like, coaching is so beneficial also just to help you get out of your own head. Like, I feel like with ADHD, it's very much in our own head. Like, even if you're sitting there looking like you're relaxing on the couch when there's a mess behind you, you're not really relaxing. You're thinking about the mess. You're thinking about this. So, like, getting out of your own head and, celebrating the small wins, like you said, having
Mhm.
not just these ruminating thoughts. So,
Yeah.
I think that's very much these
I
are great resources people are sharing, by the way. So I'm absolutely
Courses.
gonna
I
follow
want to
up with
pronounce them
this.
properly. So if you could do it phonetic spelling your name, I would love to do that because your question earlier was got me on this thing. And also I saw somebody named Jennifer had raised their hand. Hopefully they can put their message they can put their question in the chat because I want to get to that before we close out completely.
Yes.
Resources are great. Information is fantastic. Practice these. So I want to be careful around, not even careful, considerate around intelligence isn't everything, right? I talked about coaching being the ways in which individuals can, kind of have that weekly update, right? And kind of weekly ongoing. And do people meet with me more than one day a week? Yes. Are there people who meet with me? It's usually about 10 to 15% of people meet with me more than one day a week. As you go further and further through coaching, right, you're going to meet with me less, right? Most people are trying to rush to meet with me less, right? Budget reasons as well as challenges with schedule. So they're wanting to meet with me less. Sometimes they're going through something challenging that they actually need the support, so they need to meet with me literally that week. That makes sense. There are people that are meeting with me for an hour a week. There's some people that have been with me for a year and a half and are meeting with me for 30 minutes every other week. There's some people been with me for a year or 2 years, and their challenges that they're working on are complex. And so as we work on one thing, we're able to work on the next, and we work on the next thing, we work on the next thing, work on the next thing. And I'm in concert with their psychiatrist and their therapist, and we're it's a full court press approach. And they're meeting with me and they're meeting with other practitioners. Everybody's different. So if you get all of these resources, that's fantastic. That's great. Educate yourself, learn, go talk to somebody else who's read those resources as well so that you guys can powwow. You have another, that's peers. These are peers. Why don't y'all go find a workshop and take that together if the cost is too much to be in coaching? So that way y'all can go learn together and y'all can practice. Find somebody else. Now we start building a community. We don't know if we agree yet, but we know we've read the same thing and we're willing to work together and share our perspectives. This is what coaching is trying to get out of folks. But ultimately, right, we are all working kind of in our silos. So until we can get to the lovely place where we're all kind of learning and working and doing these things together, right? And then we have therapists kind of coming in and coaches kind of guiding, and we all need people kind of doing these things, kind of helping and making sure that like, oh, you can kind of do that this way. It'll be supportive. That might be a challenge because remember, you're gonna do that thing, right? That thing you do, that round robin of that thought's gonna pop up. And we want to be careful about when it pops up. What are we going to do when it pops up? Oh, I want to do this thing. Cool. I'm going to go for a walk. Cool. Make sure you go for a walk this morning so that way the walk is not associated with the anxiety or with the challenge. It's associated with you taking care of yourself.
Again, yes. Also, I do, another question was asked about ADHD coaching and if it's something that's covered by insurance. And unfortunately, it's not something that's usually covered by insurance. For therapy, you may, obviously there are places that take insurance. If you go to an out-of-network center, you may receive some reimbursement from your insurance if they have out-of-network benefits. Sometimes you may have like a health savings account for coaching, but um, yeah, and someone mentioned Candace Sam. She is the CSAM Foundation. We're very familiar with her as well. She's one of the coaches in our area. But again, it's about finding, what works for you. Um, do you have, just because this ended up being such a great discussion, is there anything on your PowerPoint that you wanted to go back to touch on? Have we touched on all of it? I'm like,
Look, I have a former career in creative. We're making decks was a daily thing. So making this deck was like a rehash and a jump back into that world. And then I got to use a little bit of like technology. So I got to play around with AI to do it, right? Because anytime we get to play with technology as coaches, especially if we know it's going to possibly be helpful to our clients, we're trying it. So that way we have something to say or do. With regards to anything in there, hitting the points of therapy and coaching is kind of what I wanted to do and say it's and if there's another it's and you and the community you build, right? You can go be a part of, you can go join, you can develop one yourself and have that one join. But the purpose of this work, right, is to allow yourself the confidence and the ability to have determination, to have oh goodness, let me go ahead and do this. Uh about week 2 or 3, sometimes 4, but usually 2 or 3. We've already done our self-monitoring exercise, and it's that we're experiencing challenges there. And we've probably done a little bit of introduction to the ACT matrix. We've done feelings and behaviors, kind of where they show up from, where they show up and how they show up. Again, part of the psychoeducation part, right? And then they're like, yay, yay, I love this, right? And we get to have the fun ADHD conversation, probably one of the most validating ones, about consequences and feelings and like what constitutes drivers and why we talk about drivers and motivations a little bit differently. And not that we need to have a whole definition change, just we want to have a distinction so that way we can do something a little bit more accurate. And so we talk about, I have the nice model where I talk about things being novel, new novel, being interesting, intriguing, things being challenging, competitive, right? Things being emotionally or energetic, and those being things that drive us, drive us, drive us. And they're a double-edged sword, right? They drive us into the thing, but if without our task management, without our systems around us that are comforting, that are worthwhile, oftentimes it can lead us to a space where there's nothing alerting us that it's been 75 minutes and we might want to go take a walk or drink some water, right? It's a good time to go take a 10-minute break. And so in that module, I immediately start talking about self determination and fun. And self determination has 3 pillars. I'll get into that later. Sorry, I'll get into the specifics of the pillars later, but I want to be considered around competency and autonomy and relatedness, right? These are the 3 pillars. I already got into it. Look at me. I'm already doing the coaching stuff. Oh, can't help it.
can you say those one more
Most
time? So competency.
competency, autonomy, and relatedness. The other side of the house is fun, right? Most things we don't do, most things we run into challenges with because they're a violation of our competency, our ability to feel as though we can learn and can do it, whatever it is. The way it's shown up, the way it's presented to us is immediately like it's immediately, how dare you? I can do this. I got this. What do you mean? I'm here, right? I'm here to do the thing, right? And so this is incredibly powerful. Yeah, the motivation piece, right? I I'm not taking away the motivation. I'm being very clear. I want to be incredibly clear about that. You still got motivation. We're not even going to get into the driver's motivation conversation. That one's fun. Ooh, that's fun, right? But most things are a violation of that core competency, right? We don't feel as though we can do. Most times when we're handed templates, when we're handed all these workbooks, when we're handed all these things, right? It doesn't develop the ability for us to feel like we can do. We're given everything. So therefore, there's nothing that's justifiably just enough friction. So I feel like I got it. I feel like I earned it. Enough. And it's not, it can't be not real. It has to be genuine. And so in coaching, we really thread that needle of here's something that's incredibly supportive with information. And here's the gritty friction that'll keep you in it, as well as here's its relief. So that way you don't become attached to it completely.
And someone is sharing, so the self-determination theory, yes, that's the first time I've heard of that. So,
Mm-hmm. Yeah, no, they're in
um,
it. No, the again, if they could give me the phonetic X, I love that we're sharing letters together, and you're in it. Also,
yes.
Sam, ADHD coach. Yeah, I love that. I'm getting kudos from my, always you're always a little bit like, I wonder if people are really gonna feel this, you know, because there's a lot of different perspectives on approaches to seeing folks with neurodivergence and or with diagnoses or don't have diagnoses but experiencing challenges. And with those perspectives come their limitations. And so one of the things that's essential as a coach, one of the things that's probably essential is when you're talking to your therapist, when you're talking to your coach, ask them about their perspective on how they see it. Do they see it as, are they a superpower person? Do they see it as a pathological diagnosis? Do they see it as a disability? Do they see it as a disorder? Are they looking at it as a diverse approach and they see that these things just exist in a kind of quilt and we're all kind of connected? What's the approach that they use or how they see things, right? Or how they see you fitting in, right? One of my really good friends is a superhero approach, right? He puts it on everything. As for me, Q, I'm a diverse approach. I see all these as working together, and we need communication around them in order to help us work better with ourselves. Because I'm already telling myself wild stuff every day, like, oh my goodness, I can't talk to myself that way. As well as how we communicate with others. Oh my goodness, I can't believe I said that. Adjusting the posture, moving forward. It's not one posture, it's many postures. It's not one way, it's many ways. And it's not merely your life. There's 8 billion people on the planet floating around you. There's going to be some variation.
Those are great questions to
Yeah,
ask
yeah,
about
I'm
the
loving
view of
these.
ADHD when you're, yeah, well, also the
Yeah.
questions that you brought up about, when
Oh,
you're looking at therapy or coaching about what their view on ADHD is, because truly that does kind of, that informs their treatment approach. So I think that's
yeah,
spot
because
on.
people hate on Russell Barclay, right? Some people love Russell Barclay, right? Some people are kind of indifferent. But at the end of the day, the question is, when you read this, is it empowering you? Some people can't stand Dr. Hayes. Some people love Dr. Hayes. Some people are ambivalent to Dr. Hayes. But when you read the work, is it empowering to you? Not, oh, does that make sense? Does it empower you? Because there's so many things telling you that you're wrong and you need to fix. And it's not a fix, and you're not wrong. Oh my goodness, so what else is there? No, right? There's so many other things. There's so many other ways to be that are not bad or wrong, right? Or disordered. Oh, who's the black woman that black girl, oh goodness, why am I put it in the email like 2 weeks ago. Oh my goodness, because we had that email thread. One of our clinicians was asking about it. Black girl, there we go. Black girl lost keys. Thank you so much. Thank you, Lisa. I appreciate that.
So the question was, are there any BIPOC authors that speak more specifically to that perspective? And so Lost Keys, is that the
Black
um
girl lost keys. I think she changed it to lost keys. So
okay.
that way it was broader. Are there more people talking? One day I may start a social media account. Who knows? And start talking, start saying things. It'll probably just be more everydayness because I feel like my sense is that there's so much that's either incredibly technical about the lifestyle around ADHD. There's stuff that's very casual around ADHD, and there's stuff that's like highly prescriptive, as though the way I help myself with my ADHD is gonna do it for you, and as though you have the skills to shape it appropriately. And now I just come back and say it didn't work. And it's like, it's not, everything requires a little shaping. It's not going to work the way that it works for them, for you, and you have other things going on. It's not, it may look similar, but it's not. It's just, it's not. So um, I would, so not an author talking about ADHD or talking about neurodivergence, um, right? But in fiction, whenever somebody is um, thinking about getting into coaching and they can handle the content that's in it, I often recommend N.K. Jemison's Nebula and Hugo Award-winning series, Broken Earth trilogy. Whenever people are interested in like becoming a coach, because of the way in which she shaped the world and the way in which she shaped the characters, it lends it to a view of people and the people that are helping, quote, helping people, and then ultimately what help looks like. And it's just fun to read and see um, and to experience neuro differences, neurodivergence, um, and through a different lens. And by the way, I don't think that's the way NK necessarily intended it. But when you read it with that lens, it speaks a little differently.
Awesome. And I can include that for everybody too. So we have a few
Sure.
minutes left. My last
Sure.
question for you, Q, is how would you, for someone, and I'll ask you based on coaching, because as a coach, bringing this, what is the best way that someone can prepare for their first coaching session? Or do they need to?
You
Is that,
always
yeah.
just have a water, have a notebook. Your first session, your intake session is like the best first date ever. I ask a whole bunch of questions. There's no wrong answers. All you gotta do is just be honest. And even if you don't know the answer or you're being dishonest, we got time together. We're gonna figure it out. We're gonna do the thing, right? And then from there, when you show up to next sessions, notebook, water, open mind, as clear as possible. If something's troubling you, just bring it up early so that way we can get that thing out of the way. Don't hold on to squat. Mm-mm. You're not doing us any favors by, "Oh, I'm just gonna hold this back and not." No, 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 no. Be ready. Just not even be ready. Just some of my folks come in yapping, just ready to go. And I'm just like, yep, let's do it. I love it. All right. I'm all ears. And I'm a yapper too, so we can do the thing. Um, and yes, Barclay does provide excellent insights. Not at all. Just giving more perspectives. That's all. Just allowing more folks to see that there's more ways to see things without a lot of the stuff.
Awesome. Well, thank you so much. And I think,
Thank you.
all in all, to summarize what I'm hearing, it's a lot of self-reflection. There are two different paths. Where are you? I like the past to present for therapy. I love the
Mhm.
present to the future for coaching. Obviously, there's overlap on both sides, but I think it's really what you're hoping to get out of it. So thank you so much.
Mhm.
We do have
And
one more.
Andrew's right. Yeah, there's
Yeah.
more ways than reading. You don't like. Oh my goodness, everybody's. One of my favorite kids that I worked with for like a little bit of time. Diagnosed, had tons of challenges reading, dyslexia, hyperlexia, that all the way down the line. Learning disabilities or learning challenges all the way down the line. Right. They're at a Ivy League school. Why? How did they get to Ivy League school? How did they use different apps to read the text back to them? Audiobooks. They do speech and edits in order to speech to text. They literally said to me, they were like, 7 years ago, when we first started working again, this is a while ago. 7 years ago, I was failing out of everything. And then once I got the skills, and then once I got the tools that went with the skills, it just they took off because they had it. They already had all the things. They just needed a way to get it out. So if you're like, oh my goodness, books are in the way, go talk to people. There's people like me that will yap your ear off about everything, all the things, and give you articles and videos so you don't have to do any of that stuff. Or if you want to just listen, audiobooks. If you want to interact with people. Um, Find a community. This is merely one means of accessing. There are so many.
I think that's perfect. Thank you again, Q. So we'll follow up with everybody on the recording as well as the slide deck, any resources that were brought up. Um, Gosh, we still have a few more questions. So if anyone wants to hang out, that's totally fine. Hopefully you can do. What is the minimum age you would recommend for coaching? I think that's just a perfect kind of ending question. What is the youngest you would recommend for coaching? That's a great question.
Wow. Okay. All right. Wow. So there's so many people I want to tap on the shoulder right now to just be like, what do you think? When I was coaching and working with folks, I'll give you this. What is the youngest age? It depends on your child and where you are. It's less about the kid, more less about the child, and more about the parent. And not that you're a bad parent. Fine. Are you ready? One of the biggest challenges that I have when we start having the age question about working with folks is ADHD coaching and therapy is not babysitting. It is especially once you drop below the age of 18, it's a full family event. It's what we're doing now, right? I like to say, like, and when I was growing up, if my mom was eating chicken, I was eating chicken. If my mom was eating beef, I was eating beef. Um, if I had a practice, we had to go to practice, right? If I had to play the trumpet in the thing, we had a trumpet thing going in the thing, right? So if I'm in coach ADHD coaching, we're in coaching because not only do I have to be ready for my child to learn somatic breathing exercise to learn ways of dealing with things and practicing things, but I'm here to learn what they're learning so I can speak their language. Because the assumption is like that, I assume with my kids, right? Oh, we speak the same language. I know my daughter loves Taylor Swift, baby. We don't speak the same language. Mm-mm.
No
Okay.
diss to Taylor Swift.
Exactly. I lift heavyweights. My son plays soccer. We don't speak the same language. I speak his language. I speak her language. So yeah, the minimum age is when you were ready to speak their language. They're a sponge. They ready. They are already
Yeah.
dealing with the challenges. You want to get them before 10, because I know that statistic that says before the age 10, we have more than 10,000 negative corrective experiences, and that will set the tone,
Yeah,
right? So as soon as possible, so that way we can start shaping positive corrective experiences.
that's a really great point. All right, everyone. Thank you so, so much. Again, we'll share this with everybody. Thanks for staying a little bit late with us. And thank you again, Q, for everything. This was so enlightening and I had so much fun with you. So thank you so much.
Thank you so much. You have a beautiful day. And all the folks in the chat, everybody sharing everything, your perspectives. Oh my goodness, your perspectives. I love it. Please share your perspectives. This is what helps everybody become better.
Yeah, I completely
And the
agree. Thank
13
you,
and 14
everybody.
year old, definitely I started coaching folks at like I started getting 12 and 13-year olds. And I was like, I wish we could start sooner.
Awesome. All right. Thanks, everyone. Take care. Bye.